get this show started. So I hope
If
you
you're
guys had a
watching this
very
video,
wonderful
all you need to
week.
do is
Weekend is upon
click the like
us. We
button
are
and hit the
waiting.
subscribe button. Welcome to my YouTube
Hi.
channel. Enjoy this
Hello,
section.
good evening.
Good evening. How are you doing?
I'm doing very well. Welcome to Friday Night Free Talk.
Thank you very much.
Yeah, it's an honor to have you on this platform today. I feel very honored. So we'll be talking about we'll
The
be talking
network is a
about
bit dodgy.
yes, I can see that. Okay, so first of all, I know a lot of persons, I mean, don't know my guest today, so I'd like you to, you know, tell them a little bit about yourself before we can go about our, questions.
Okay, so my name is Abigail Simon-Hart. I'm actually a breast cancer survivor. I was diagnosed in 2014, so it's 6 years now. I'm actually cancer now. I run a health firm to run an NGO, a cancer NGO as well, to work with people who already have been diagnosed with cancer. That's essentially what I do.
Oh, that's quite a profile. It's an honor to have you. I mean, it's an honor. So,
Thank
first
you very
off, we're
much.
gonna, we're gonna ask you to enlighten us a little bit about this ailment, cancer. We want you to tell us about cancer, like, the symptoms and possible causes of cancer. Mm, yeah, I see you 26 more. I yeah,
A bit dodgy there.
yeah. Okay, so I said, I want you to enlighten us a little bit about cancer. What are the causes of cancer, and
Okay,
what are the symptoms? We want you to
sure.
just give us a
Okay.
little.
First of all, a lot of people have this impression that you can catch cancer. You can't actually catch it. What cancer
Okay.
is, it's your own.
Oh my God.
Okay. So what happens
Yeah,
is
yeah,
that
yeah.
your cells normally divide and then they die. But with cancer cells, they don't stop dividing. They just keep growing and growing and growing. And the mechanism for them to die doesn't work. So they grow so much that they form a lump or a mass. This can be in your
Okay.
breast. It can be in your, it can be bone cancer. All cancers form lumps, like your leukemias, they don't form lumps, but they're cancer cells that are in your blood if it's leukemia. And what
Mm,
there's certain things that predispose you to getting cancer. One of them is if you have a direct relation, a parent who has cancer, like a mother, father, close sibling that
yeah.
has cancer, then that predisposes you. But however, only 5 to 10% of cancers are hereditary, are inherited. So 90% of
Okay.
cancers, we don't know what causes them. But what they have shown is
Okay.
that lifestyle can influence you getting cancer. For example,
Yeah.
smoking, drinking a lot of
Yeah.
alcohol, being obese. Those are some of the
Yeah.
things that, where inhaling a lot of smoke, like if you're in a very polluted environment, being exposed to
Hmm.
radiation, like people who live up near power lines, things like that can predispose
Yeah.
you. So it's really important that people watch their diet, they exercise, and they eat healthy as well. And then really reduce alcohol, and smoking really is a no-go when it comes
Yeah.
to cancers. It's really not the way forward. So very,
Okay.
very often cancer is a lifestyle disease. That's why you find that nowadays you're seeing people in the village getting cancer, because back in the day, what happened is that you woke up in the morning when the sun got up, and you went to bed when the sun went down. You didn't have generators. You were eating your food fresh every day. You didn't have freezers and fridges and microwaves and all those kind of things. And what's happened
Yeah.
is that we moved away from healthy eating. We become westernized. We're eating a lot more
Okay.
processed foods, drinking a lot of sugary things. So our diet has really if you look at people now, people are getting quite fat. We're becoming quite lazy. We don't do exercise. So more and more, we're finding that because of change of lifestyle, we're actually seeing more and more cancers. So definitely lifestyle has a lot to do with why we're seeing a lot more cancers. Apart from the fact that screening also, we're screening a lot as well. So with the increase in screening, it's also being detected as well.
Oh, okay. I hope I haven't lost you.
Go back.
So hope yeah. I thought I lost you again.
No, no, no.
Okay, so I mean, having said that, can you briefly tell us some symptoms, of cancer? How someone is gonna know that
Okay,
he,
okay. Cancer symptoms are kind of it depends. For example, let me talk about breast cancer specifically. Very often, breast cancer presents as a lump, very often, but that is not the only way it presents, okay? And what you find that 95% of breast lumps are not even cancerous, but if you find a lump in your breast as a woman or as a man, because men get breast cancer, so if you find a lump, strong chance it will not be cancerous, but it's better to get it checked. Then also any changes in the way the skin looks. If you start to get rashes on your breast, or the nipple goes in, or there's any kind of secretion from the nipple, you need to get it checked. Do you get what I'm saying? Or if one breast looks bigger than the other, it's also important to get it checked. And then also, if you start having passing blood in your stool, for example, it could be piles, but then again, it could be something much worse. Or you start vomiting blood, or you start getting really, really tired, you start bruising easily. It really depends on the kind of cancer. And what I always tell people, anytime you're not feeling right, go and get it checked. It doesn't mean it's cancer. You know what I'm saying? We have this thing of self-diagnosing. We're very good at self-diagnosing and going to the chemist. Once you're not feeling well, go and get it checked. And I can tell you something, that very often people have a gut feel when something is not right. They can deny it and say it's not my portion and all those kind of things. But the reality on ground is that most people, when they're very unwell, they already have a rough idea and they're scared of going to the doctor. And the thing about cancer is getting it early. The reason why I'm cancer-free and I survived is because we got the cancer early enough to do something about it. So it's really important that if you find a lump, or you're bleeding from anywhere, just go and get it checked, because it doesn't mean that, it means you're going to die at all. The important thing with any disease, not just cancer, is getting it early enough that you have choices. The later you leave it, the less choices you have. It doesn't mean that you won't survive. It means that the chances are reduced. And the amazing thing is, nowadays, even stage 4 cancers are living a very long time. I've met women who are stage 4 cancer and they're 12 years into survivorship. They're living normal lives. They go for their chemo, like you take your anti-hypertensive drugs and stuff, and they're doing okay. So cancer doesn't have to be a death sentence. You know what I'm saying? And that's the most important thing for people to know. We always have this thing, oh my God, I've got cancer, that means I'm dead. That's not so. It doesn't mean that you're necessarily going to die. It's about when you get a diagnosis, it's about making clear lifestyle decisions and getting treatment. Simple, get treatment.
So I mean, that's a nice tip. So let's talk about Bricon Foundation for a minute before we go ahead and talk about cancer again. I'd like to know what motivated you, to start this foundation.
Okay. Basically, when I'd had a mammogram done here in Nigeria, and I just had a gut feel that everything wasn't right. So I decided to redo the mammogram when I went on holiday, and they now discovered that I had cancer. And I was fortunate that I had insurance, so I was able to do all my treatments in England. And when I came back to Nigeria, I decided, let me just check out what it would look like if I was diagnosed here and had to get treatment here. And I was horrified with what I saw. There were so few options. And I just realized that, look, it's not enough just to have your cancer treatment and get on with your life. If you're in a position, because you've walked that road, it's important that people you encourage other people, that you enlighten other people, that you make a difference. So we set up the foundation because my mother also died of cancer. My mother died of leukemia. But my mother had had cancer 4 times before that. And she lived for 33 years after the doctors told her she was going to die. So the doctors told her she had 6 months to live, and she lived for 33 years after the doctors told her she was going to die. And that was just evidence that really it's God that has the final say. Do your own bit. Doctors will do their bit, and all God has the final say. So my mother actually lived for 33 years after they told us she was going to die. And then she got leukemia, and she was dead in 6 weeks afterwards. She was dead within 6 weeks. But she died very peacefully, without any pain. And it really taught me that there's also this thing about dignity in death as well. It's not just about, are you alive? It's, are you having quality of life? And what I realized was, it's not enough just to keep on pumping people with medication. You also need to make sure that those who really aren't going to make it have the best quality of life possible. And you give them the best quality of life as long as possible. And the only way to influence that was actually to have a role in it. And that's why we set up the foundation, to help people who have already been diagnosed with cancer. So we don't do a lot of screening. We really focus on people who have already been diagnosed with the disease. Because if you tell me I have cancer, then what next? There's lots of screening going on, but okay, I've been told I have cancer. What's the next step? Who's going to help me? Who's going to help me pay and stuff like that? So that's why we decided to set up the foundation, to try and support patients and their families who have been diagnosed with cancer, because cancer doesn't just affect the patient, it affects the entire family as well.
Yeah. I mean, that's a very good thing, you know, when you do something out of passion and, you know, will for helping others. It's always good. You know, so have you had any challenges so far, you know, starting this foundation? Have you had any regrets, or you know?
No, definitely no regrets. It does get very frustrating sometimes, because as you can imagine, because cancer patients don't come out to talk about it, a lot of people don't believe that you survive cancer. So donations towards cancer treatment are not that great. I'm sure if I said I was going to have a party, invite some celebrities to come and play, I'll get money for that. You know what I'm saying? But if it's drop money, drop 2 million, drop 5 million, drop 3 million to pay for cancer patient treatment, a lot of people are very reluctant to drop money. That's the challenge that we have, is that funding for cancer patients. I'm sure a lot of NGOs have this similar problem, especially here in Nigeria, where cancer patients aren't speaking up. Those who have survived aren't talking about it. So everybody assumes, okay, you get cancer, you die. So if the track record is more are dying than living, then people are very reluctant to donate towards it. So I think one of the biggest challenges that we have as cancer charities is that funding is quite difficult to get. And then cancer treatment is really expensive. That's another thing with cancer treatment. So getting people to donate can be a challenge. Then the other thing is that I think that people are also quite scared of cancer as well. So you find that people, even getting patients to go for treatments, they are very reluctant. They rather go to a church or go to a traditional healer or whatever than go for conventional treatments. And then unfortunately what happens when that fails, they now come back to get help, by which time it's already late. So one of the challenges that we have is that it's not a matter of late detection. It's often detected in time. It is late presentation for treatment that's the problem. You know, with all this, there's a lot of screening going on in Nigeria now. So people are getting more and more aware. So, but when they're told they have it, they're now scared. They now go away and then they present late afterwards. So that's one of the biggest challenges that you have, is that you're getting people coming really, really late. And that is so frustrating. Because we even had people who came to us at the beginning, then they run away to go and try other things. And then they come back for help, and by which time it's late. So it really is about early detection. So it's really, we really just need a lot more people to donate. That's to donate cash, kind, etc. So we can actually help people, because if you don't have funds, then you're just basically what you're doing is, okay, you can train doctors and nurses, because we do training. Thanks to Macmillan Cancer Support, we've been able to train nearly 260 doctors, nurses, and NGO workers in cancer awareness and breaking bad news. So we do training. We also give out mastectomy products. So we've given out about 300 mastectomy bras and breast forms, thanks to donations again. But it boils down to donations. we need people to
Yeah.
give. Do you know what I'm saying? Because if nobody's
Yeah.
giving,
Yeah. I get that.
then what do you do? So that's a challenge that we have. The biggest challenge
Oh,
is people coming late and
yeah.
funding, that people just aren't that willing to donate towards cancer treatment because it's expensive and because we don't get enough
Yeah.
survivors coming out to say, okay, look, I beat the disease, to encourage people that yes, you can actually survive the
Yeah.
disease. Yeah.
Yeah. And that I think that's the reason why a lot of people actually still die in silence and not speak out, because people that have been diagnosed over time don't come out to say this is what I've been through. So I know you've said a lot about challenges and reasons why you started the foundation. So can you still enlighten us on the impact you've made so far in Lagos? Yeah, the impact you've made so far, in
Okay. Basically,
Mhm.
the impact we've made is mainly Lagos because we don't have a huge team. And also,
Okay.
we're great believers that if you're doing something, let it work very well in your immediate area, and then you can now
Yeah.
start talking about expansion.
Yeah.
It's something that we were starting newly. My co-founder's father died of prostate cancer. So
Oh,
between the two of us, we both lost a parent to cancer. Then obviously I had cancer myself. So
yeah.
that was the rationale behind setting it up. But
Yeah.
we felt that it's really important that we focus on Lagos in the first instance because that's where our office is. And I
Hmm.
really believe that you need to make an impact in your immediate environment. And
Yeah.
and the idea is that once we can perfect Lagos, then we can start extending. We have supported patients who have had to go to Ibadan for
Okay.
radiotherapy, for example, but we are trying to
Yeah.
restrict it to the immediate area. First of all, because as I said, we don't have a huge team.
Much
And then
funding. Yeah.
secondly, and then there's the funding issue as well. And then also
Yeah.
what's really important to us is accountability. We want to
Yeah.
be able to we don't just throw money at the patient. We actually have somebody that goes with the patient to the hospital, sits in
Okay.
on the consultations to make sure that the patient is fully conversant with what's going on, because knowledge is power. I'm a
Of
great
course.
believer in the truth will set you free.
Hmm.
When people understand something, they're not so afraid. What makes people afraid is when you don't understand. Do you know what I'm saying? And that's why it's
Yeah.
so important that you have somebody that actually explains to the patient what is going on, what to
Hmm.
expect. We have support groups. We actually have a support group for women. We have over 100 members. And then we've got a
Okay.
support group for men as well, called Help for Husbands. And this
Hmm.
support group was set up for men who either have lost a wife or has a wife who has cancer, or young
Okay.
men who have been put into the position of a husband because there's no
Hmm.
father figure or whatever, to support
Yeah.
the mother, the sister who has cancer, and also for men who have cancer as well. So we also have support groups that support people who are going through that as well. So
Okay.
yeah.
Okay. That's very good. I mean, so my next question was going to be, do you intend, I know you said, because of funding and, you actually want to make sure that, you impact your immediate society before reaching out to other states. Would like to know if you have intentions on, reaching out to other states or reaching out to other communities with this foundation, or, if there's a way that they can still come to you in Lagos if need be.
Okay.
Would like to know that. So,
What's happened now is, for example, we recently did some donations of prostheses, breast foams, and mastectomy bras, and there were patients
okay.
who were coming from Kebbi, from Ibadan, from other states into Lagos for their radiotherapy, which meant that they were going to be in Lagos, and they came and they were
Okay.
able to benefit from it. So we don't restrict where you come from. The issue is that we don't have the capacity to extend the service beyond Lagos. Do you get what I'm saying? So
Okay.
we've
Okay.
had,
Yeah. Yeah. Yeah.
do you get what I'm saying? So like the women who
Hmm.
needed the mastectomy products, they were not based in Lagos, but because they came to Lagos for medical treatments, they were able to
Hmm.
benefit from the mastectomy products that we were able to give out free because of a donation. And what's
Hmm.
important to understand is that when we say we give out these products for free, it means the patient doesn't pay. It does not mean that they're not paid for. Do you get what I'm
Yeah.
saying? Whenever you
Yeah.
say anything is free, what has happened is somebody has given money to cover the cost.
Yeah.
So we're
Yeah.
able to
Yeah.
give them out to the patient at no cost.
Yeah. Okay. I get that. Extending to other states has to be like a futuristic plan, or it's
Yeah,
not in the plan at all.
to be really honest, it's not in
Mhm.
our immediate plans because we have a lot of demand already in Lagos. The demands in, and then the demands in Lagos are absolutely huge, 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 huge. So, and then we're back on the issue of limited funds as well. So it's everything. It's chicken and egg. If you have plenty money, then you can set up branches everywhere. Do you get what I'm saying? But it's also good to be very good where you are first. Be known, do everything, consolidate all your networks and everything else. Then you can now maybe start setting up branches. But for now, we're inundated with requests from Lagos already. That I think it would be irresponsible of us to try and stretch ourselves beyond Lagos and then in any way not give the service for which we're known. Do you get what I'm saying? It's all about really being able to deliver the goods and not in an attempt to try and cover everybody. They are not doing a good job. If you're running an NGO and you're running it well, it takes a lot of time and dedication, and it takes a lot of follow-up. It's not easy to follow up your patients. You just don't want where you keep on increasing the amount of people you have, and you're not able to really follow them up. Cancer, when you finish your treatment, it doesn't end there. It's quite dramatic when you have stopped your cancer treatment and the doctor tells you, okay, go and live your life. And for the last 5 years, you've been going to see the doctor regularly. Then suddenly you are told, go and live your life, and you're sitting and thinking, but what happens if the cancer comes back? It doesn't. The cancer follows you for the rest of your life, even when you're clear. There's always this thing in the back of your mind, what happens if it comes back? Do you know what I'm saying? So it requires a lot of support. It's not it really does require a lot of support if you're going to do it well. So, yeah.
Okay, I get that. So let me talk to the people we have live. I don't know. Some persons just joining and some persons have been here. So just in case you're just joining us, we're talking about cancer. We're just creating awareness on cancer, and we have Abigail Simon-Hart of Bricon Foundation, and she's enlightening us about cancer and symptoms and whatnot. So you feel free to ask your questions if you have any, and feel free to also join in the comment section so that you can be part of us. So I have another question for you. It's believed that cancer patients, most persons that have cancer, have this loss of life. They have this feeling that they give up. So I mean, if you've met anyone, okay, I think we have a question before I ask that. Someone just asked a question. They say, what are the age range of getting cancer?
You can get cancer. They're babies who have cancer soon after they're born. There is no age range, unfortunately. And I think that is a challenge with cancer. There are babies who have cancer. If you go, I'm sure if you go online, Instagram, you see accounts with tiny babies who have cancer and they're being treated within days of being born. So unfortunately, there is childhood cancer as well. Cancer does not discriminate. It doesn't care about your religion. It doesn't care about your race. It doesn't care about your age. That is a challenge with cancer. It is not a respect of a persons at all. It affects everybody. That is a challenge with cancer.
Okay. So, so I'm talking about if you have any advice for people that are possibly living with cancer, or in order for them not to lose hope of life, or try to get help, any words of encouragement for such persons.
I think the most important thing with when people ask me, am I going to die? Because I deal with quite a lot of cancer patients. I tell them we're all going to die. The one thing you're sure from the day you're born is one day you're going to die. Death is sure for everybody. And my mother was evidence. I told you my mom, they told her she had 6 months. We only lived for 33 years. So the problem is that we need to focus on living and not focus on dying. Every day you wake up is a gift. Some people get up, they get hit by a car. Some people get killed in a car accident. So I think that the challenge is that if you focus on dying,